Hello everyone, today we will speak about types of diabetes for Krok 1. A lot of questions come about diabetes and we should know the difference between them and how to approach these questions. First thing we need to understand is the famous diabetes type, diabetes mellitus. Before we get into it, let's revise briefly the physiological role of insulin. So in the pancreas, we have the beta cells, okay, and these cells secrete for me a hormone called insulin. Now, when we eat something containing glucose and the glucose in our blood increases, how will insulin respond to that? Insulin will be released from the pancreas, okay, and will make glucose enter the cell. So insulin will make glucose enter the cell. That's why insulin will decrease glucose in the blood. Now, after we know this simple piece of information, we now take the pathology, which is diabetes mellitus. It's simply, okay, we now take the types, something wrong with the insulin. The insulin is either not there, okay, or beta cells are destroyed, okay. Thus, we have no insulin. Let's see what will happen if we have no insulin. Okay, no insulin, nothing will take the glucose into the cell. The glucose will stay in the blood and glucose inside the blood will increase, causing for me increase glycemia, increase glucose in the blood. Okay, so this is diabetes mellitus. It's a chronic increase of glucose in the blood because of deficiency of insulin. Let's take the types. Okay, we have type 2 and type 1 diabetes mellitus. Type 2 diabetes mellitus, we call it insulin independent. While type 1, we will call it insulin dependent. What's the difference between them? If we take type 1, easier to understand, we have the destroyed beta cells of the pancreas, no insulin, as we said, okay, and this will lead to increase glucose in the blood. The glucose will not be taken by the cells to perform their actions, metabolism, and so on. So increase glucose in the blood. That's why this type of diabetes mellitus will be dependent on insulin. So that's why we call it insulin dependent. Dependent on insulin for treatment. In treatment, okay, it will be insulin. Okay, so we don't have insulin, we compensate it by insulin drugs you will take later on, okay? But now just for the Krok 1 level. Okay, type 2, it's called insulin independent, means that it does not depend on insulin. The insulin is secreted, there is nothing wrong with the beta cells, okay? The insulin is secreted from the pancreas, okay? But when it tries to take glucose into the cell, it tries to speak with the cell, tells the cell, please let this glucose enter, okay? The cell will not respond. The cell will not respond to insulin and will not take glucose. So this is, we call it increase resistance to insulin. The insulin is there but is unable to perform its functions. So independent of insulin, there is diabetes. There is increased glucose in the blood anyway because insulin is not able to stimulate the cell, okay, to take glucose. That's why the result will be the same as well, increased glucose in the blood. And this type, okay, we need more than just other than insulin to treat it, like in Krok 1 glycine. Okay. The symptoms of diabetes, let's write them for the both types, will be polydipsia. It's increased. Poly means increased. Dipsia means thirst, increased thirst. Polyuria, okay, and which is increased urination, and glucoseuria, which is glucose in the urine. So let's explain briefly why these symptoms appear in diabetes. Of course, the main symptom here we have, the main syndrome is hyperglycemia, increase of glucose in the blood. Let's speak briefly about why these symptoms appear. So we have increased glucose in the blood, hyperglycemia. This increased glucose in the blood will be filtered. So here we have the kidney, and if we enlarge the nephron of the kidney, the nephron means the filter of the kidney that will make for me here urine. Okay, so the blood will be filtered, okay, from the blood into the kidney to make urine. So when we have increased glucose in the blood, okay, a lot of glucose will fall into the filter of the kidney, okay, and normally, okay, some of this glucose is reabsorbed back into the blood, okay, like this is normal physiology. The glucose enters the filter and then gets back to the blood. It's normal. But in case we have increased glucose here, like in diabetes, this increased glucose will start to spill into the urine, will start to appear into the urine because it's more than the kidney can handle, okay, and will appear in the urine. We call it glucoseuria. Now, this we explained it. Next thing, why we have polyuria. So glucose, okay, polyuria means increased urination, like we have more amount of urine. The urine is like more in liters. Why? Because glucose does not go outside alone. It grabs with it what? Grabs with it water from the cells, because we call it osmotic diuretic. So it grabs with it water. That's why we will have also polyuria, increased urination. And because of losing this water, okay, the patient will have increased thirst, and this is called polydipsia. Okay, so these are the first type of diabetes mellitus briefly, okay. Next type we will speak about it, diabetes insipidus. So what is the story here? The story here is also, it's called diabetes, but it has nothing to do with glucose. Here the key word is water. Here we have a lot of water into the urine. We have polyuria, but the glucose in the urine and in the blood is normal. So keep that in mind while solving these questions. So why we have polyuria only? So logically, if we have polyuria, increased water in the urine, it means that there is something only in the kidney. So let's revise some of the hormones. We have a hormone here in the hypothalamus produced called vasopressin. Hypothalamus is an area within the brain, okay? And this vasopressin will go into the posterior pituitary. It's also a gland, okay? And then it will be released. What this vasopressin will do, it will go to the part of the nephron of the kidney, okay, called the collecting duct. This part here, the last part. Okay, and this collecting duct, okay, it has water. Okay, because we want to form the urine, right? The urine has a lot of water. So vasopressin, what it will do, it will reabsorb water back to the blood. Vasopressin, reabsorb water back to the blood. That's why, okay, we have some of the water, okay, when we need this water, we will be able to get it and not lose it in the urine. This is normal physiology, okay, not speaking here about any diseases. Normal action of vasopressin, reabsorption of water from the collecting duct in the kidney to the blood. Now in diabetes insipidus, simply we have something wrong with the vasopressin. It's not there. It's deficiency of vasopressin. Okay, so no vasopressin, okay, this process will not happen, and water will stay in the urine and will go outside in the urine. That's why we will have polyuria, because we don't have any reabsorption of water. And the key word here in the question will tell you 10 to 20 liters of urination. It will be much more higher than the polyuria we found in the diabetes mellitus, okay? And it will be just polyuria without any glucose problems. Okay, so this is briefly about diabetes insipidus. Let's take the renal diabetes. So renal means kidney. Here, diabetes related to the kidney. The problem here is, if we understand the normal physiology, let's speak here. We have here glucose in blood, normal. Normal glucose in the blood, no problem with any pancreas or beta cells. It's absolutely normal. It gets filtered, okay? We know that glucose gets filtered normally, okay? It's normal that it gets filtered, but it does not get past this area, okay? Glucose will not get past this area. It will be reabsorbed, okay, within the first part of the kidney. We call that first part, sorry, from the nephron, proximal convoluted tubule. It gets reabsorbed here, and it does not allow, we don't allow it to go further than this stage. But in this type, okay, there is something wrong with the proximal convoluted tubule. It cannot reabsorb, no reabsorption of glucose. That's why glucose will continue its way to the urine. Okay, so that's why we will have what? We will have also glucose urea, glucose in the urine. Okay, but in the question they will tell you normal glucose in the blood. So that's the difference between the diabetes mellitus, okay, which had a glucose in the urine, yes, like renal diabetes, but high glucose in the blood. While here we have normal glucose in the blood, but glucose in the urine. So surely there is something wrong here. Okay, there is no reabsorption back to the blood. Glucose will stay into the renal tubules. Okay, the last diabetes type is called steroid diabetes. Okay, so this is not in the kidney, something above the kidney. We call it the adrenal gland. The adrenal gland has a cortex and medulla. Cortex of the adrenal gland, this part here, secretes a hormone called cortisol. Of course, maybe you know it already. So cortisol elevates what? Elevates glucose levels in the blood. And that's will cause for me hyperglycemia state, and we can call it diabetes. So this is a steroid diabetes. Why it's called steroid? Because cortisol in nature, as like in chemistry, it's a steroid. Okay, let's read some questions and test ourselves. After recovering from epidemic parotitis, a patient began to put off weight, like lose weight. So he had a inflammation of the parotid gland, okay, and then he is losing weight, okay. He is permanently thirsty, polydipsia, drink a lot of water, polydipsia also, frequent urination, polyuria, voracious appetite, okay. Now he has complaints of skin itching, weakness, furunculosis. So these are also all complications or symptoms of diabetes. His blood contains glucose 16 millimoles per liter. The normal glucose, you should necessarily know it, it's 3.3 till 6 millimoles per liter. Ketone bodies 100. Okay, if they mention ketone bodies, we have like in our course we explain about ketoacidic coma, why it happens. Okay, but here let's continue the question. Glucose urea, glucose in the urine. So it's also, so here it's clearly diabetes mellitus. Okay, we have all the symptoms of diabetes, but which type of diabetes exactly? So is it insulin dependent or is it insulin independent? So when we were explaining about insulin dependent and insulin independent, we said that the difference between them is in the reason or pathogenesis. The type insulin independent was because of increased resistance to insulin, right? But insulin dependent or type 1, it's because of deficiency of insulin. But here in the question they mentioned all the common symptoms, and we have no way of knowing which answer is right because we don't have the reason for it. So how do we know? So this is a patient recovering from parotitis. Okay, and parotitis is inflammation of the parotid gland. And here, okay, parotid gland inflammation, most probably because of a virus called mumps virus. Okay, and the mumps virus will activate autoimmune process which damage the all glands in our body. Okay, it's a complication of mumps virus, including the pancreas gland. Okay, which will damage what? Now we reached the reason, which will damage the beta cells of the pancreas. That's why we will have no beta cells, no insulin. So it's a type that depend on insulin. We call it insulin dependent type. So this is one clue we can use to solve the question. After a virus infection, after also here insulin dependent type happens more in children, but here they did not help you in the question. They did not mention anything about children. That's why it's like a little bit advanced question. So parotitis, also ketone bodies here, it's a complication of diabetes mellitus type 1 or insulin dependent, that we have increased ketone bodies. We call it ketoacidotic coma. Okay, so this is also another clue for this question. Okay, while insulin independent diabetes, okay, it will happen because of increased resistance to insulin. It happens more in adult people like 40 plus years old, and it will not be related to virus infection or autoimmune process. It will be related maybe to obesity. Okay, and other reasons, of course, like steroid diabetes, no mentioning of any cortisol. Diabetes insipidus, how we can like exclude this answer. In diabetes insipidus, we will not have increased glucose in the blood. Okay, only polyuria. Okay. Next question. A patient complains of frequent and excessive urination and thirst. Urine analysis revealed the following. So he has polyuria and polydipsia. He has diuresis or urination in 24 hours. They take it 19 liters. Okay. And they did not mention anything about glucose. So it's surely a problem with reabsorption water back to the blood, and no vasopressin, diabetes insipidus. Next question. A 50-year-old patient during examination presents with glucosuria, okay, glucose in the urine, and blood glucose of 3 millimoles per liter. Now pay attention. Glucose in the urine, okay, so we can have either diabetes mellitus or diabetes, renal diabetes, because both of them have glucose in the urine. But when we check blood glucose, it's normal. So diabetes mellitus have not have increased blood glucose in the increased blood glucose. So it cannot be diabetes mellitus. The normal blood glucose is 3.3 till 6, okay, maybe 3 till 6 for this question. So here we have normal blood glucose in the question and high glucose in urine or glucosuria. Okay, so this is which type of diabetes we took? It's renal diabetes, okay? Normal glucose in the blood and glucosuria. This is due to defect of reabsorption of glucose or renal disorder. The last question, the patient with complaints of polydipsia, permanent thirst, applied to the doctor. He has hyperglycemia, polyuria, and increased concentration of 17 ketosteroids in the urine is revealed what disease is most likely. So here they tell you the normal symptoms of increased glucose and increased steroids, okay? Or like 17 ketosteroid is like in synthesizing steroids, we have precursor of this in biochemistry. It's not important, but steroids is increased, including cortisol, which will elevate the glucose and do for me all of these symptoms. So it's a steroid diabetes. And this is like a brief of all the diabetes types, okay, to keep it in mind while solving these questions. If you like this video, please you can support us by following us on Telegram, Instagram, and YouTube. Thank you.